5 minutes after 11 o'clock. Are you ready to learn something new? Because every week we learn something new from Dr. Riadh Fakhoury. He's in the studio this morning. This is his show. It's called the Head to Toe Care Show, and your questions are an important part of this show. So if you have a question for Dr. Fakhoury, give him a call now. Don't wait till the end of the show when we don't have much time. Right now is a good time. This is the WOCA Climate Control Source Hotline 622-9622. That's area code 352-622-WOCA. Dr. Fakhoury is a chiropractic orthopedist and the owner of Fakhoury Medical and Chiropractic Center here in Ocala. And good morning, Doctor.
Yeah, good morning, Larry. How are you?
Pretty good.
Good.
You were out doing something fun again. I saw some. You guys are always doing something fun, posting pictures on Facebook, and then you still have time to come in here and.
You have to enjoy your life, right?
Oh,
makes the work and the fun at the same time, also.
Nicely said. Yeah.
Thank you. We had so many nice questions last week. It was wonderful.
It was one after another.
That's right.
And people are. You know what? You're educating people on one thing. You don't need to be in pain. There's always a way. There's some way. I'm guessing there's always some way to relieve pain.
We work very aggressively at the Fakhoury Medical and Chiropractic Center to help people get out of pain, and that's our focus. We deal with musculoskeletal issues, and that's our specialty. That's our focus, and that's our multidisciplinary approach to be able to help people. We had an interesting case come in last week. And with that case, what happened was that lady came in. She's been a prior patient, severe neck pain, unable to turn her head left and right. We took some x-rays. She has a lot of thinning of the disc degeneration right in the middle of the neck between number 5 and number 6 or 7 bones in the neck. Between the 5th and the 6th one, it was narrowing, and it was pinching the nerve. And we ordered an MRI, and not only was the nerve being pinched, but the spinal cord was being pinched also. So we explained to her the different scenarios of where she needs to be. She really has minimal relief with conservative management, so we referred her to Dr. Hobbs, our interventionalist who does the injections, and he gave her a trigger point injection which took away about 50% of the pain.
Oh, wow.
And then the next week he gave her basically an epidural injection which helped take another maybe 40% of the pain away, so she was 90% relieved. And if we look back in time maybe 5 years ago, she would have been at a surgeon's office. That would have been a surgical case.
Yeah.
And she would have had surgery by now. So with our conservative approach, we've been able to help people, even cases that used to go into surgery, and help them avoid that need. And in fact, the surgeons actually refer to us to try to stabilize that patient and get them out of pain to avoid the necessity of surgery.
There was a guest on David Letterman's show. I don't remember, so some movie star or something, and he was complaining about a tennis elbow. He always has this tennis elbow, and so David Letterman says, "Well, why don't you go to the doctor?" He says, "Well, it's intermittent. It doesn't always happen." I was thinking about you, and your 3-day rule.
Right.
If it's intermittent, you're never going to accumulate 3 days, but it seems like something you wouldn't want to live with.
And intermittent means it comes and it goes,
yeah.
It comes and it goes. So why is something reoccurring? And if it comes back, something's not right. And what that person will notice is that that intermittent problem will become an occasional problem. That occasional problem will become a frequent problem, and then the frequent problem will become a constant problem. And at that point, when he comes in with constant pain, it's very complex to take care of, because by that time the wrist may be involved, the shoulder may be involved, the neck may be involved, because when your elbow hurts, you sleep funny, you move your arm funny.
Yeah.
Instead of using your forearm musculatures, you might start using your shoulder musculatures. Therefore, another problem will start to develop in the shoulder area up into the neck. So if you find that you have a complaint, whether it's a headache or neck or back pain or shoulder or knee pain, and it comes on and off, that's something that definitely needs to be looked at, because early treatment will be much more effective, much quicker, and much more cost effective also.
Now, what would be tennis elbow? Is it from using it too much, or what is it?
Tennis elbow, the technical terminology is lateral epicondylitis. Lateral means the outer part of the arm versus the inner, the outer elbow. epicondylitis. The epicondyle is the bump that we feel at the outer part of our elbow, and there's 3 very large muscles that turn into a tendon and attach into that epicondyle. So basically what happens is those 3 muscles start to pull and tear away from the epicondyle, and that tearing causes inflammation and causes very pinpoint pain at the elbow, and people lose their ability to grip and to twist, because when you twist if the listeners actually bend their elbow and twist their hand and put their palm up, the motion comes from the elbow.
Oh yeah.
And so with a lateral epicondylitis or tennis elbow, those 3 muscles are very inflamed and sensitive, and that people start to lose use of that forearm because of the pain in the elbow. It can be very severe, very debilitating, to a point where people start to drop things.
And again, you don't have to live with it. That's the amazing thing.
That's a good thought.
Good morning. You're on there with Dr. Fakhoury.
Yes, good morning, doctor.
Good morning.
Speaking of tennis, when you twist your knee, severely twist your knee, and you get a fluid buildup, first of all, why is there a fluid buildup, and would it be important to have that fluid removed like at your office?
Okay, thank you very much. Very good question. There are compartments in the knees, and there are sacs, which are called bursas in the knee. There's a lot of them in the knee. And so what happens when you twist your knee, there are several options of things that could happen. You could have a very bad injury. One of the worst injuries you could have is tearing the medial meniscus, or the cartilage between the knee. You could also tear something called the cruciate ligaments. There's anterior and posterior cruciate ligaments, which allow stability of the knee so it doesn't slide forward or backwards. Those are the most severe, and some of those, like when you hurt the meniscus, usually you'll get a good amount of swelling in the knee. When you hurt the cruciate ligaments, sometimes you'll get a lot of swelling, sometimes you won't. Other things you can do when you twist your knee that are not so severe is that you could sprain your knee or strain your knee. You could tear muscles or stretch ligaments, and that can result in swelling. You could also get bursitis, which is the sac that is there to protect the tendons and muscles from rubbing on bone. That could swell up, and you get a bursitis, which will cause a big, almost like a knot in your knee. It could be in the back of the knee, above the kneecap, below the kneecap.
Yeah.
So again, when somebody has a knee problem, the best thing is for them to be in our office, for us to look at them, to do orthopedics, and to palpate that knee, and we can be very specific to see, is it a simple problem like a collateral ligament strain, which is the ligaments on the inside and outside of the knee that stabilize it, or could it be severe like a disc meniscus tear of the knee? And they present differently also, and the pain is at different locations. The amount of swelling is different also. So to answer your question, swelling of the knee means there's been an injury, there's been a tear, the body's reacting, and fluid is coming into a closed area. There are compartments that fill up, and then when that happens, you end up getting the bogginess or the swelling of the knee, which indicates something is wrong and needs to be addressed.
Is the fluid like helping to heal the knee?
In the beginning it is. Very good question. But
would reducing the fluid, having it drained, relieve the pain?
Yeah, you can have the knee drained, and again, the problem with the fluid is sometimes it fills in a compartment and the body can't clean it up. It can't come in and remove that swelling, so it stays there. And in the beginning, the inflammation or the swelling is a healing process, but if it gets to be too much, it starts interfering with the healing process, because it becomes a barrier that your body can't get in and allow the healing to happen. So in a scenario like that, ice, number 1, sometimes bracing the knee, number 3, rest, and at times if that doesn't help, then the knee is drained, where a needle's inserted in the area of fluid, and then the little backward suction is produced to pull the fluid away from the knee and to remove the fluid out of the knee, so the healing process can take effect.
Would you say like in a couple of days, if you still have the fluid, that's when you should come in?
Yes, I would say again 2 to 3 days. If it's swollen, and if you know you hurt yourself, the knee is a pretty easy joint to know you've hurt yourself. When you're limping and when you're hobbling, or when you need a cane and you can't put pressure on it, you know you've hurt the knee. That's probably a good idea to come in. It's a very vulnerable joint because it's not supported very well from the sides. But it is a very easy joint to take care of. It's one of the easiest areas of the body to treat.
Would part of the treatment be like to wrap it or something at that point?
Yes, sometimes we'll use the PRICE price.
Right.
P is protect,
Okay.
R is rest, I is ice, C is compress with an ACE bandage or a knee support,
Okay.
and E is elevate. Pick it up with pillows so it can drain.
Okay.
We have a marathon runner that came in actually yesterday. She's a nurse practitioner, and her entire right leg was swollen. The entire
Oh my
thigh,
gosh.
the outside of the thigh, and the knee was just swollen. And of course, being a very avid runner, she continues running. But
Yeah.
what was happening was that the problem was progressively increasing, where her right thigh was actually 1.5 times the left thigh, so very swollen. She didn't notice that. She wasn't looking at that. Almost an outside view helps to be able to see that. So we brought her into the office, took X-rays of the knee. The knee was cleared, no arthritis, very healthy. The meniscus was a good space. Then we did interferential therapy, which is an E-stem to reduce the spasm, massage for 15 minutes to break up the adhesions in the knee, and an adjustment of her pelvis to line her pelvis up so there's less stress on her knee.
Yeah.
And she did great. All the swelling practically came out of that.
Yeah.
And the legs, when she left, were equal, and she felt much better afterwards. So knees are easy to take care of.
Yeah. And after your knee more or less heals up in that, how long would you say before you get the okay to, let's say, play tennis again? A couple of months or weeks or?
Not that long. We would start with a little bit of rehab, probably within 7 days, 10 days maximum.
Yeah.
And because if we don't start the rehab and start to build the muscles, then the muscles start to atrophy, weakness sets in, and then the knee becomes unstable, and then it's prone for a second injury or worsening of the problem.
Yeah.
So as quickly as we can start giving very simple exercises, for example, even just with your legs straight in bed, flexing your quad will help to activate that muscle, which is a very important muscle to stabilize the knee.
Yes.
And that will help to keep the strength so it doesn't atrophy or start to get weak.
Okay. Well, thank you very much for your answer.
Thank you for those questions.
Yeah. Bye now.
Bye-bye.
It almost sounds like the thing that is giving us trouble, making us uncomfortable, is actually healing us. And like with the water in the knee, it sounds like that's there for a reason, but at the same time, we want to.
It is. What happens, Larry, sometimes the body comes in and it's doing its best job to bring healing properties to the area.
Yeah.
But sometimes you almost have too much of a battle between the body healing and the damaged area, and it swells up, and inflammation is just basically a buildup of water and waste and toxins, and that becomes like a barrier, and your body can't get past that barrier to be able to heal. And so we have to drop that barrier so the body can get in there and heal, and that's done in cases quite often with massage. It's done with ultrasound. We have an ultrasound therapy that helps reduce the inflammation so the body can heal. Laser therapy, we have cold laser, which helps reduce the inflammation so the area can heal. Sometimes mobilizing the joint, getting it back into place, because if the knee or the back is out of position, it irritates the area and the irritation persists. So once we put the bones back in proper position, the irritation subsides so the area can start to heal.
We can visualize the physical things you're talking about. What I have a hard time with, and this is again something that I've always heard was a healing, is when you get a fever and a headache together. The fever is actually there for a purpose. It's healing. It's getting rid of something.
It is.
So if you take an aspirin and it gets rid of the pain and lowers the fever, how is the body fighting something if you've undone the fighting mechanism?
Well, very good question, in that the fever is elevating basically the inflammatory process or the fighting process between, let's say, bacteria and your immune system is producing a battle, and that there's toxins in your body, and that starts to cause this feverish type syndrome. With the fever, your temperature in your body starts to elevate, and elevation of the temperature is one of the ways the body fights bacteria, because bacteria is very sensitive to heat. So the elevation of temperature in your body helps to kill the bacteria. But the problem is, if the battle is extended, or if it's a very large bacterial infection that your body can't just overcome and subdue very quickly, then the inflammatory process, the fever, starts elevating, and it gets to areas that start getting dangerous, because the brain is sensitive to too much heat, and other organs are sensitive. So you have to now bring that under control to a certain degree. And there are methods, there are medications that help. There's also the chill blankets that they use to be able to do that. There's lukewarm water to put, for example, a baby into to pull heat and draw heat away from the body, because we want an inflammatory process. We want the immune system to fight the bacteria, but sometimes we have to slow that down a little bit so it doesn't become dangerous for the individual.
Oh, okay. And if we do it on our own, I mean, we're kind of gambling, aren't we, a little bit?
Keep track of the temperature and make sure that the temperature is not getting too high. And moms are great at this. And grandmas are taking the temperature of the children or the grandchildren, and they're watching, and they know when it gets to a certain level, and they look at the child. They know that it's getting dangerous. Usually a cool, lukewarm bath, Tylenol to bring the temperature down. And if the temperature stays elevated or spiking, usually immediately to the emergency room so they can work on and bringing the inflammation down and fighting the bacteria with some type of specific antibiotic.
Does the application of heat actually do the opposite? In other words, if we put a heating pad or that stuff that you rub on that feels hot, is it actually hot, or is it just...
The stuff you rub on will not really produce inflammation, but let's say that, we talked about tennis elbow or lateral epicondylitis. Let's say that you had a board and you needed to screw it in, so you're working with a screwdriver. The next day, your elbow is hurting you because you irritated those 3 tendons that go into the outer part of the elbow, and now it's hard for you to grip and to hold, and it's uncomfortable, and you're holding your elbow up and supporting it. In a scenario like that, if you apply heat, now there's already an inflammation because there's a tendinitis, lateral epicondylitis. Itis means inflammation. So let's slap some heat on there. What are we doing? We're warming it up, and that brings more inflammation. So it'll feel good for about 1 to 2 hours because you numbed it with the heat, but once that passes, it's going to throb, and it's going to be very painful. And now you've slowed the healing process because you've brought in more of a barrier, a fluid barrier that the body can't get through, so it'll slow the process down and increase the possibility of scar tissue and adhesions in that area that will cause ongoing problems. So what we do in the office, it's safer usually to put ice in a moist towel and apply it on for 10 to 20 minutes, 20 minutes for a larger area, 10 minutes smaller. And then if it persists, get into the Fakhoury Medical Chiropractic and let's see what we need to do. Sometimes it needs a little more help, in that it might need ultrasound, laser, maybe massage. Sometimes inflammatory processes, nerves get trapped by inflammation. Let's say a disc gets hurt and there's an inflammatory process. Well, the nerve and the disc are very close together, so that swelling gets in and starts to put pressure on the nerve, squeezes the nerve, and now that person might have leg pain. And we may try decompression and rehab, massage, chiropractic, and we may not be able to stabilize that patient. The best answer for them might be doing the interventional medicine or doing an epidural injection to be able to remove the swelling off the nerve. And cases of that would be where there's so much pressure, and it's not routine. We wouldn't do that. The case would be if there's so much pressure on the nerve can't get the food to whatever it's supplying, and that area is going to have permanent problems because of that. So first thing we want to do is reduce the inflammation with the corticosteroid, bring the swelling down, take the pressure off the nerve, and then allow the flow. There's an exoplasmic flow or nutrient flow in the nerve that will bring the nutrition back to that organ and help it to recover.
Just the opposite, the cold, like a cold pack, or and I think your office has a product that's like a roll-on product called BioFreeze. Am I saying it right?
That's right.
Does explain that? It feels cold, but is it actually cold?
Well, it has a different products in it which will give you a warming effect, and then when it warms, the air hits that, it gives you a cooling effect because of the perspiration and the warmth. So that's a very nice topical product that we have in roll-on, in gel, in spray. And people use that to help to sort of subdue or reduce the muscular pain that they might be having, and that gives relief. And when you give relief, then that helps with the healing process.
Is that something that we need to take or use very conservatively, like only for a tiny while?
Yep, hopefully just for a tiny while, because as we said, if you're using it over and over and for an intermittent problem, you really haven't gotten to the source of the problem, and that's where you need to get that taken care of, is going to the source of the problem. So if you're using that, just like an aspirin, and you find you're taking it day after day after day for a headache, then that means we really haven't taken care of the problem.
If you have a question for Dr. Fakhoury, I know somebody was on the line and then I got a busy signal, so I don't know if it was disconnected on our end or yours, but go ahead and call back. The line is open. It's the WOCA Climate Control Source Hotline, 622-WOCA, 622-9622. Dr. Fakhoury, of course, helping us stay pain-free and without surgery, unless it's absolutely necessary. You have figured out a way to help us avoid that.
And you know, that is truly a team approach of the healthcare team, is to try to bring the person back to good health, whether it's within our facility or other physicians that we're working with, to try to take care of that person at the lowest rung of the ladder, the safest rung of the ladder. And you know, unfortunately, some people will have to be referred on to surgery because we cannot relieve the pressure off the nerve, or they have a herniated disc that's not going to respond to conservative treatment. In scenarios like that, we do need to have the surgeon. But the team approach to try to help the person as conservatively as possible is a very good one. That model works well.
And looks like you have a phone call. Good morning. You're on the air with Dr. Fakhoury.
Good morning. I have a couple of questions because I'm just such a skeptic about all these things. They're supposed to be wonder cures and everything. And there's two of them, and I'll ask about them, and then I'll hang up and let you explain them. One is Epsom salts are supposed to be good. Now, as far as I know, Epsom is just a town in England where salts are made, and I wonder what's so special about them, because they don't actually absorb it through the skin or anything. And the other one is, what is the great healing benefits of some Australian flightless bird called an emu that they make, you know, this ointment out of that's supposed to be especially good. So I'll hang up and let you explain. Okay?
Oh, wow. Okay. Yeah, I'm all ears with this one, too.
Yeah, it's very good. The Epsom salts, again, that's been used for a long time, and I don't have a specific reason for why people may feel better utilizing Epsom salt, except just thinking about it more from a chemical perspective. You're not really pushing the Epsom salt or the salts into your body, but I believe what happens when you put Epsom salt into the tub and you rest into it, the salt produces an increased density into the water. In other words, the water has more particles in it than within your body, and at that point your body is primarily fluids, and so fluid will always go from a less dense to more dense area. So what might be happening is inflammatory processes, because if you have sore muscles, let's say you exercise and you have sore inflamed muscles, there's some extra fluid into those muscles. So when you soak in the Epsom salts or in the salt bath, what happens at that point, I would imagine, and that's why so many people go to you know, the hot salt baths and things of that sort, those natural springs. I believe what occurs is that the extra fluid in your musculatures, in your skin, gets drawn out and into the bath water to help reduce the inflammatory process in your body. I believe that's how it works. So we're not pushing salt into your system, but developing a more dense environment around your body where the solutes or the solid parts will, or the inflammatory process will move from inside to outside. So hopefully that's a clear answer for you on that. There are so many different topical products. We mentioned BioFreeze. You mentioned the Emu. There's the Tiger Balm. There's so many different ones. You know, and there's no real specific study if this one works better than the other one. So on that one product that you're mentioning, I don't have any data or information to say that it works, number one, or if it does work, if it works better than other topical products. For example, there's a lot of herbal products that are said to be able to help in reducing the inflammatory process or pain on joints and muscles, maybe surface area of your body. So I don't have any data to say that does work. and I don't have any data to say if it does work, if it works better than something else, because there are a lot of products out there that people try, and some people feel that it helps them. So if you try a product, if you feel it helps you with the pain, if it's natural, if it's not pushing any solvents or solutes into your body, for example, people put DMSO, and yes, that helps give relief, but if it's an industrial grade DMSO, anything you put on your skin goes into your body and your bloodstream, and that could be dangerous.
And we'll squeeze in one last one at the end of the show here. Good morning, you're on the air with Dr. Fakhoury.
Okay, so the follow-up question is, it doesn't matter if it's just regular salt or salt from England called Epsom. It's just the salt itself is what does it. Is that correct? And I'll hang up again.
Thank you again for that follow-up question. If we are sort of working with the same, I don't know if there's any difference in the properties of the Epsom salt versus the other salt. For example, there's sodium chloride, there's potassium chloride. There are different types of, salt. And so I'm not sure if it's a different mixture that might be more coarse, that might dilute better into the water and be absorbed better into the water. I would say if we stay with the same idea that the movement of fluid from your body into the water because of the increased density, I think that you'd be safe to say any salt would work. However, maybe the Epsom salt has a different property to it that helps to dissolve better in the water, so you have more of a solute breakdown, because different compounds and different products will dissolve in water better than others, and you may get a higher dense solution using an Epsom salt than the other. I would encourage you to get on the internet and do some research and find out, and get back with us and let us know. Maybe the Epsom salt has a chemical property that dissolves better in water that could increase the density of the water versus the regular table salt that we use.
Interesting, and that kind of throws me back to when I was a kid. There were a few things like that. There was I remember brown soap my mom would use. I don't even know what brown soap was. And Epsom salt. She used to have something called drawing salve. You don't hear of these things anymore so much. But
right, and a lot of the Chinese products are like that. They'll put some salve on you to draw some of the inflammatory process out, or so that's what they're meant to do, and they say it.
Interesting. Yeah.
It is.
Some old remedies sometimes may still work, and we don't know why.
And we should do a study. Walk a few miles, and we'll try Epsom salt, and walk a few miles and try table salt. Let's see if there's if there's a difference.
See if it works. Yeah. Well, another interesting show just flew by as always. Doctor, what is your phone number?
The number at the office is 351-3413. That's 351-3413. We're on 17th Street at the bottom of the new bridge at the light on the right-hand side. If you're heading towards 200. And if you press extension 4, it will take you to our patient care coordinator, who will be happy to help you, as well as the front desk, and they can answer any questions that you might have. If you have a question you'd like to have me call you back, or if you want to come in and get evaluated and get some direct answers, we'll be happy to do that.
Comment from a listener, by the way: God made you to be a healer. Even your voice is healing.
Oh, thank you.
Even your voice is healing. Dr. Riadh Fakhoury, thank you so much.
Thank you very much.
We'll take a little break, and we'll be right back.
Accident, injured, hurting. Pain affects so many of us and keeps us from enjoying our daily routine. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Let me visit with you to answer your questions. Let us help you help yourself on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA. Again, that's Dr. Riadh Fakhoury, here to help you on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA, The Source.
The weather is brought to you by myfwc.com. Life Jacket.